I'll just share one thing of how, in my own journey of recovery, of how during my substance use, I never knew how mental health people living with mental health conditions were treated until it happened to me. Like when I was hospitalized on drug overdose, they didn't provide me a space, saying that this is clearly a police case. So until a police case is filed, we cannot treat you. The hospital, which is supposed to be a safe space, they called the police and they did the FIR in Bombay, and after that only they put me in the hospital. And when I woke up, the thing that I realized was I was bound by ropes. And also the police person was sitting by the side of the bed and asking me from where did you get the stuff, with whom do you did the drugs, how much was the cost, and asking everything about that sort. And I don't know, my senses was coming up and down. And after seeing that police person on my bed, I was more terrified. But after that incident, I had to be flown back to Manipur because I could not study, I could not do anything. My recovery journey was horrible. In Manipur, there were no person who could treat me because they wanted to treat the substance and not treat me. They did not want to listen to my story of who is Sadam and why it is happening to you. They wanted the story of you have been a drug user, so this is the way we will treat you. They prescribed me medicines for like 3-6 months and put me under the room for 3-6 months. I could not move out from house. But when the medication got over, the doctor said, yes, Saddam is well, he can walk now. So he'll send him back to Bombay. Within 1 month, I overlapsed. And that overlapse was so horrible that they put me in another hospital. And that time it was not ropes. I was put behind the bars and there was no people attending to me, support. It was not there. It was like a person who's a criminal saying in the bars, and the doctor is treating you in a way that they don't touch you. But what helped me was after that, again, I had to be flown back to Manipur after that because no one could take care of me in Bombay also. So the only option left was for me to think that's what is it that is lacking in the system and what is it that I am really wanting. And I found out that it was a very simple thing. I just wanted somebody to listen to me, without judgment, just listen to me, just give me a space to express what is going through. And I didn't get those spaces even in the biggest hospital in one of the biggest cities in India. When I came back to Manipur, when one of the person told me like what is happening to you, I spoke out. And that was my first step to recovery. They gave me that space. And I realized, if I can give this space to other persons, we can do a huge change. Doctors don't provide. They give you 10 minutes of their time and prescribe you a list of medicines and also 1,000 rupees. So for us, that the model that we are creating, we don't charge anything from anyone. COVID time also, in the last 2 years, we received more than 2,000 calls.